Hello, everyone. I'm Dr. Brian Harasha, and I'm here to share a video slideshow on proven ways to help increase your immunity, which will be very important right now as a novel virus is spreading among us very rapidly. I'm the owner of Advanced Laser Therapy and Wellness, and I provide services like chiropractic, acupuncture, and functional medicine out of the Brentwood Center of Health here in St. Louis, Missouri. I want to start with a disclaimer that I am a healthcare professional with many years of training in functional medicine and nutritional therapies, and I do not work for or represent any for-profit companies. SARS-CoV-2 is the name of the virus that is causing the disease named COVID-19. And SARS-CoV-2 is a new virus, and therefore there is not sufficient research available to make strong claims. However, there are hundreds of research articles on other SARS and coronaviruses which are closely related, and it can be assumed that much of the research will also pertain to SARS-CoV-2. This information does not claim to treat or prevent COVID-19. It should never take the place of standard medical care. It is only meant to help build up resiliency and reduce the severity of its effects. So for now, we can't really control this new virus. However, we can control the host. And we have been learning through the media that there are many factors that make us more likely to contract COVID-19. These include cardiovascular disease, hypertension, diabetes and obesity, chronic pulmonary disease, chronic liver or kidney disease, radiation therapy, autoimmune conditions, chronic neurological diseases, and I would probably add age, asthma, sleep apnea, and poor gut health. Some statistics show that comorbidities are really important in relation to this virus. 71% of those hospitalized with COVID-19 in the US and 78% of those in intensive care have underlying health conditions like those we mentioned in the slide before. And it's interesting that 25% of us infected with COVID-19 may not show any symptoms. So there are 399 patients with at least one additional disease had a 79% greater chance of requiring intensive care or a respirator or both, or even of dying. And it is known that 60% of adults in the US have at least one underlying condition. This is sometimes startling, but it's amazing that we can get through our daily lives okay, even though we have an underlying condition. It's usually mediated by chronic long-term inflammation and oxidative stress. So why does SARS-CoV-2 spread so easily? One reason is the long incubation period. So this chart shows that the incubation period can range from 0 to 14 days. And it's also interesting to note that most people do start to show signs of the illness at about 5 days after infection. The other challenging thing is that this virus can live for quite a long time on surfaces. You'll see all kinds of numbers in the media, anywhere from 1 to 13 days. And also the virus can aerosolize, meaning that it can spread in tiny particles through the air. The most common symptoms of COVID-19 are fever, cough, unusual fatigue, and shortness of breath. There are some other minor symptoms, and one that I noticed that's not in this chart that seems to be true is that people start to lose their sense of smell and taste. So add that to this list. And this chart just helps you to compare COVID-19 symptoms to other things like the flu or a cold or allergies. And what you'll notice is that COVID-19 clearly has cough, fever, and breathlessness as the most important symptoms. The flu often has other things like body aches and headaches. Colds tend to have runny noses and sneezing, and allergies are mostly runny nose, sneezing, and watery eyes. So really you want to look out for cough, fever, and shortness of breath. So what exactly happens in a viral infection? Well, step one is that the virus makes it through our external defenses like our skin and our mucosal linings. After that, the virus may escape our innate immune system. So I'll discuss the immune system in the next slide. If it escapes our immune system, it's able to enter our cells. And once inside our cells, the virus will trick our cell into making more copies of the virus. And in the case of SARS, our immune system might actually overreact. So keeping SARS out of our blood is the very most important thing we can do. And as you can tell in the media and even our governments are getting involved, that we need to practice social distancing, being a minimum of 6 feet away from people, probably even further if you're following someone who's running or biking. You'll probably want to use a mask to prevent those small droplets from getting into your mouth or nose, and also help prevent you from touching your mouth or nose. And you should be very hyper aware of surfaces. You might want to even use gloves, and you'll definitely want to disinfect all surfaces often. I like to use hydrogen peroxide, or you could use alcohol that's 71% or more. Those would be good things to use at home. And you'll also want to be washing your hands frequently. And you probably heard the rules of at least 20 seconds with a lot of soap and getting every part of your hand. And be extra careful if you have any breaks in your skin. So keeping your immune system healthy, this is the first thing you should be doing. There are no medications that are going to help you. There are supplements, but nothing is going to be as strong as just taking care of your body. And these are the things we're all been told over and over to the point where it's almost boring, but I really want you to pay attention to this because this is the very most important thing you can be doing for yourself. So eating healthy, a balanced diet. Many would say the Mediterranean diet is probably the best. And you're going to focus on eating a lot of fresh vegetables and fruits and avoiding sugar and processed foods. You also want to keep exercising, and we will recommend mild to moderate exercise, as doing very extreme exercise will actually lower your immune system for a little while. So keep it mild to moderate. Make sure you're getting plenty of sleep and good quality sleep. This is where the sleep apnea is important. You want to make sure that that is not interfering and that you're properly treated. And also whatever you can do to manage stress. Either reduce the stresses in your life or improve your body's ability to cope. We'll notice a lot of journal articles are coming out now, especially in the Journal of Nutrition. These are very recent articles about using nutrition to help fend against COVID-19. Here's the slide on how the immune system works. So I'm actually going to use the mouse cursor and have you follow along because this is a little complicated. So our immune system is split up into two branches, the external immune system, which is our skin, our mucous membranes, and things like that. They're just physical barriers. This is where you could actually also put in social distancing and masks. These are all barriers to keep the virus away from us. Then we have an internal immune system. This part of the immune system is actually split into two sections. The first line of defense over here is made of phagocytes. These are cells that will recognize invaders and foreign objects and literally engulf them and digest them. And then the other one here, NKC, stands for natural killer cells. These are cells that are meant to recognize a cell that's been infected by a virus and attack that cell. Then if we move over here to the second line of defense, you'll see T cells and B cells. So T cells are meant to find those foreign particles and bring them to your lymph node. So I'm going to go down to this slide in the bottom left. You might have heard of your lymph system and lymph nodes. These are all meant to be a way for your body to process foreign proteins. So if your body finds a foreign protein in your lungs, the T cell is going to bring it to the nearest lymph node. And at the lymph node, we have B cells that are designed to recognize proteins. Believe it or not, when we were born, we were given B cells to recognize any protein that could exist on our planet. And what will happen is the T cell will present the virus protein to the B cell. And when it finds the B cell that matches that protein, that B cell will make antibodies. These are little proteins that are designed to attach to foreign proteins and inactivate them. So this is actually how vaccines work. In a vaccine, they purposely inject a portion of the virus so that your T cell can recognize it, and it's a non-damaging protein, so it's safe. And it's going to bring that protein to the B cell, and your B cells are going to make a whole bunch of antibodies to that protein. Now, if that virus comes into your body, you will already have the antibodies created, and they'll be able to deactivate that virus very quickly. So moving on to nutrition that can help those first few arms of the immune system. So I've split this into basics and advanced. So the basics are what I actually recommend to a lot of people to keep their health optimally in an optimal place. So these are vitamins A, B, C, D, and E, and minerals like selenium is Se, and zinc. And I put copper with the zinc because you always want to have a good ratio of zinc to copper. If you're going to supplement with extra zinc, you want to make sure you're also getting some copper. Probiotics, these are beneficial bacteria that live in our gut. And what's pretty amazing nowadays, they've characterized all these good bacteria, and there are certain strains that are known to improve immune function. EFA stands for essential fatty acid. These are fatty acids that are necessary in your body, and your body cannot create them. So you'll notice people using things like fish oil is the most common EFA. Melatonin you might have heard of. This is actually a hormone that helps with sleep. And I put that in this list because we do want to make sure we're sleeping very good. But also melatonin is known to stimulate the immune system. And then phytonutrients, you're going to see this in almost all my slides. These are all those small nutrients that aren't really characterized well. They're not technically a vitamin or a mineral, but they are in all the fruits and vegetables that we eat. So a nice little trick is trying to eat all the colors of the rainbow every day, because then you'll make sure you get all the different phytonutrients. If you want to work a little more advanced on preventing this virus from infecting you, allicin has been known to be very effective. And this is actually a substance that comes when you crush garlic. And some people have always thought, oh, if I eat a lot of garlic, that will help my immune system. And that's true. However, that allicin is not very stable and will only be effective for about 20 to 30 minutes in your body before it destabilizes. So there are companies out there that will actually sell stabilized allicin. Alimax is one of those brands, and that is a form of allicin that stays active for about 8 hours. Another favorite company of mine makes a product called Biocidin and one called Oliverex. These are actually botanicals, plant-based herbs that are known to be very antimicrobial, killing bacteria, viruses, fungus, and yeast, even parasites. Licorice has got a lot of good research as being good to support the immune system and work against viruses. GSE stands for grapeseed extract. This is also very good antimicrobial. Beta-glucans. So these are substances that are inside of most mushrooms. So you might have heard of people boosting their immune system by eating more mushrooms. It's because of these substances called beta-glucans. And sulforaphane. This has a lot of research too, and you might have heard of the benefits of eating broccoli sprouts. That's one of the best sources of sulforaphane. There are also some supplement companies that make it. And then I always like to throw in modalities. These are things you can do physically with your body. Being a laser therapist, I'm especially fond of blood irradiation by laser. This is where we would shine a therapeutic laser on a vein in your body right under your clavicle, just for a couple minutes to help stimulate all the blood that passes through. And this will enhance the activity of the white blood cells. It'll provide more oxygen to the blood and reduce its acidity. PEMF stands for pulsed electromagnetic frequencies. There's a lot of research on this in helping boost circulation and generally support the health of the body. Massage also helps improve circulation and the immune system. And of course, acupuncture. And I've included a link down here. This will be shown throughout the slides. But people who do want to add supplements to their basic lifestyle at this time, we're offering a discount of 20% off of all products on my supplement dispensary. You can basically shop there and get that discount on anything you want to purchase. So how, if the virus has evaded our first line of defense, how does it enter the cells of our body? So you're going to start to hear about this ACE2 receptor being the site of infection. And this is true. ACE2 receptors are on almost all cells in our bodies. They are actually upregulated or increased in our body in response to chronic low-grade inflammation. So this is where working on those underlying conditions is really important. You don't want this low-grade inflammation going on and creating more and more ACE2 receptors on your body. And there's also, as I wrote here, controversy over ACE inhibitors. These are very commonly prescribed drugs to help with hypertension, and a common name is Benicar or lisinopril. These are drugs that block the activity of that enzyme. And the controversy is that doctors are still not sure if that's a good thing or a bad thing. So they're not recommending stopping the medication, and they're not recommending starting it. I'm sure in the next few weeks or months, they'll probably have some more studies that can give us a definitive answer. So, knowing that that's how the virus enters our cells, are there any ways that we can help block that process? And yes, there are. This might be one of the most well-researched areas as far as SARS-CoV-2, because anything we can do to prevent that virus from infecting our cells is important. So you might have heard of quercetin. This is used a lot to help with like an antihistamine. Used during allergies. It also helps protect the lung. And what's interesting about quercetin is that it seems to be found a lot on the surface of our cells, and it's described as a slippery substance. So you can imagine it kind of coats the cells in your lungs and prevents things from sticking to them. And then we'll see good old vitamin C and D again. We'll see an herb called angiographis. It's very common in traditional Chinese medicine. It helps support the health of the lung tissue. Skullcap or scolaria is also another Chinese medicine. Stinging nettle, another famous folk remedy for allergies, also helps stabilize lung cells. Resveratrol, this is a highly studied nutritional supplement these days. This is what's found in the skin of red and black grapes, and it's been known to help with aging, and it also helps block this particular virus from entering cells. Lactoferrin, another nutritional substance, and here we see sulforaphane again, and phytonutrients again. And I put in parentheses here chloroquines, like hydroxychloroquine that you've heard on the news. That's how that drug works. It also blocks the virus from entering the cells. So now, if the virus did get through your cell wall and is now infecting your cells, what can we do next? Well, the goal here is to block that virus from replicating itself. So there are also nutritional substances that help block that process. Here we see vitamin D again. We see essential fatty acids again. We see zinc and selenium, licorice, grapeseed extract. A new one here is curcumin. This is actually the substance that is part of turmeric that makes it orange. and boswellia. And then over here we have resveratrol again. We start to see green tea, phytonutrients again. ALA stands for alpha lipoic acid. Methylation factors like specific forms of methylated B vitamins or SAMe. And then NAC is N-acetylcysteine. And I put in parentheses here remdesivir. This is actually the medication that they're testing in clinical trials to see if it would work to block viral replication. So this, we'll go on a little tangent here. Specific to a lot of the SARS viruses is the fact that while they're in our host cells, they create an immense amount of oxidative stress, and they activate inflammasomes to start what's known as a cytokine storm. So these are, you can consider them bad side effects of the infection. They're actually so bad that they're probably what cause most of the serious effects when someone's infected. So anything we can do to reduce oxidative stress and cytokine storms will be in our favor. So I want to describe the cytokine storm a little more. So if you go through a timeline here on the upper left, in the beginning, a normal immune response is triggered, and various cells like macrophages will release cytokines, and these cytokines will activate other cells to help destroy virus-infected cells. While that's happening, inflammatory markers start to be released, and what happens with this virus is that a lot of our immune cells that have these cytokines will actually burst, and they'll release more cytokines. And now you'll see we're starting to have an immune response out of control, and it's like a downward spiral. They'll just keep releasing more and more of these cytokines. And if you have too many cytokines, you'll actually start to get lung damage, which we'll see in the next slide. So this slide's a little busy. You might want to take a picture of it if you want for later reference. I'm going to work mostly down through the middle here. So if the virus enters your lungs through the bronchus ends in these little bunches of air sacs, alveoli. And these air sacs are what we use to exchange oxygen with carbon dioxide. So you'll see a blow up of an alveolus right here, and a capillary, a blood vessel, will surround this little air pouch. And the air pouch has two types of cells. Type 1, these have a really thin membrane, so thin that oxygen can actually diffuse right across it into our blood. And then we have a type 2 cell. These are a little different. They're surrounded by a surfactant, kind of like an oily substance, and they can also transmit oxygen across that substance. So if we look at this slide, here we have an infected alveoli, and you'll see the virus particles starting to build up. And what will happen is we'll get to this stage of the game where we have a moderate infection, and in the blow up here, you'll see that we start getting dilation of the capillary, we get these immune cells, we get these cytokines, we get inflammatory signals. And all this leads to the buildup of fluid in that little air pouch. So this is when people start getting that shortness of breath. It's kind of hard to breathe because there's fluid blocking the exchange of oxygen. Then what happens if this goes on and that cytokine storm gets more and more severe, that fluids totally fills up the alveoli, and proteins start to rush in. And when the proteins rush into the fluid, it actually thickens it and almost hardens it. So I heard one ER doctor describe this, that a healthy alveoli, if you could feel the lung of a healthy person, it's so soft, it's almost like cotton candy. But if you get to this point where you're starting to fill with fluid, that lung tissue feels more like a soft marshmallow. You can still breathe, but it starts to get pretty hard. And then if it gets to this severe stage where it's filled with protein, that lung tissue feels more like a stale, hard marshmallow. And this is where we're really in trouble. People will be put on a ventilator at this point and hope for the best, because that's really hard to get the exchange of oxygen at that level. So, what can we do to reduce oxidative stress? You're going to start seeing some familiar substances here: vitamin A, C, and E, selenium, copper, and zinc. A new one, glutathione, is actually our body's master antioxidant. It's really good at sweeping up any oxidative stress. Resveratrol again, curcumin again, alpha lipoic acid and N-acetylcysteine, and of course phytonutrients. And if you get to the point where the cytokine storm is starting to occur, you can also use vitamin A, B, C, and E, selenium and zinc again. Our friend stinging nettle helps here. EFAs, the fish oils, will help. And then SPMs, I want to explain these for a moment. These are a fairly new player in the world of nutrition and inflammation. It stands for Specialized Pro-Resolving Mediators, and they are designed to help resolve inflammation. So inflammation always goes through a cycle. It gets initiated and it slowly climbs to a peak, and then our body has many different they're called resolvins, but ways to resolve the inflammation or turn it off. And this I find interesting because you might have heard in the media that you should not use ibuprofen, Advil, Aleve if you get COVID-19. And that is because those substances, those NSAIDs, even though they do block inflammation, they also block the resolution of inflammation. So if you started to have a cytokine storm and you took those substances, it would be hard for your body to turn the storm off. But SPMs help the body to turn that storm off. Melatonin shows up again. So melatonin here, you would actually take at a very high dose, and that helps reduce cytokine storms. Boswellia again, curcumin again, and phytonutrients again. So here's a list of references that I drew up really quickly. Most of the information from my presentation is from the IFM, or the Institute for Functional Medicine. This is the top dog group in our country that is doing a lot of research and helping physicians practice functional medicine in the best way. At the bottom, I put some contact info. I do have a business Facebook group if you want to be able to communicate back and forth easily there. And I also, during this time, created a Facebook group specifically to the coronavirus. This is where we can share information, up-to-date information on the virus, and you'll stay more in touch that way because you'll get notifications when there's a new post. And then I wanted to thank you for taking your time to watch this video, and I want you to leave with a lot of resources for further research. You can contact me. I have my website here. Here's that Facebook profile again. Here's the phone number for the local office in St. Louis. Here's that Facebook group if you'd like to be able to join in the conversation. And then your options after this talk. Number one, like I said in the beginning, to stay healthy and work on your underlying conditions. Number two, you could add herbs and supplements to help protect yourself and your family. See that discount link below. If you'd like to see me in person, you could call the office or book a visit online using this web address. And because there's so much confusion going on right now, I have started an immune system program where I work one-on-one with people to not only teach them about what we just talked about in a more deeper level, but also to help working on some of those underlying conditions that could be a risk factor. So by using this link, you can book a free consultation. I'll talk about the program, let you know everything, how it works and what it costs, and we could work one-on-one online that way. And again, on the bottom, using this link, you can shop for any products you'd like. Everything's 20% off until July. If you want to have more of a concise list of things to take, just contact me. I've made a little handout on basic things you can do, advanced things you can do, and then if you do get infected and are having symptoms, what you can do in that case, and actually give the specific products you can choose. So I hope that's very helpful for you, and I hope you enjoy the rest of your day and stay well. Thank you.